Well, I think if you're a patient and you decided you want to have some cosmetic work done, I think it's really important, certainly from my point of view as a surgeon, that a patient knows what it is that's bothering them. I think they have to be quite specific as they can, so that way that will allow me to understand the problem and therefore direct the treatment accordingly. And I think that very often patients come up with a whole list of things because they've been thinking about it for so long, that they get carried away and I say, I want this, I want this, I want this. And I think it's quite important to prioritize a little bit, because you just simply, we're not going to stick you in a box and suddenly, presto, it's all been sorted out. Each treatment requires its time and effort, and so I think it's good to prioritize and tell us what it is that bothers you most, so that I can then focus a little bit more on what treatment is best. Non-surgical procedures have really come up a lot these days, and I think in the last 10 to 15 years, in fact, they played a really important, integral part of our approach in offering any treatments. Simply put, there are some situations and some conditions that require surgery and others that require non-surgical intervention. Both surgery and non-surgical work together, hand in hand, so one starts off from where the other one leaves off, and they really can benefit the patient significantly. Many times with respect to non-surgical treatments, it's simple things like lines, wrinkles, little slight folds, or even maybe skin texture problems, color mismatches on the skin. These kind of things can be addressed through non-surgical means. In general, whenever there's loose, sagging, any excess hanging or folding of the skin, that's when surgery is required to actually reposition things and restore the youthful appearance that you've had, in the earlier years. But of course, any surgeon will be able to be in position to explain to you and tell you that this is really what you need in terms of surgery, and this is probably best dealt with through non-surgical means.